Autopsy Doctors of Reddit, what was the biggest revelation you had to a person's death after you carried out the procedure? Assisted with a post-mortem when I was a student. Female patient died in her 40s. Her medical history had extensive complaints of abdominal pains. One doctor even referred to her as a hypochondriac and others commented on apparent anxiety. Opened her abdomen, and she had extensive scar tissue. She was absolutely massacred inside from endometriosis. She suffered for decades and never got referred for a laparoscopy. She didn't have fucking anxiety, she had a medical condition. I'm a veterinarian and sometimes I do necropsy, basically autopsy for animals, and one of the more notable case involved a prized Wagyu cow that died mysteriously. Wagyu cows are very expensive to rear and fetch a good price at the slaughterhouse. After cutting her open, I found metal wires extending from her stomach into her heart. It's what we call "hardware disease." Apparently the cow decided that eating metal wires for constructing fences was a good idea. Normally the farmhands are quite good at keeping these hazards away from the inquisitive bovines, but I guess slip-ups do happen from time to time. Masters in forensic pathology here. You'd be surprised to know the number of people that have life-threatening issues that never went diagnosed and that they didn't die from. Seen an older guy who died of pneumonia in hospital. On autopsy the guy had both an enlarged heart and a couple of medium-sized aneurysms in the brain. Another guy in his 70s apparently came into the ER and had chest pain then died shortly after. Dies of a heart attack, but also had cancer. In less natural circumstances though, saw a guy who had been shot in the head a couple of times. 3 definite entries and a blown out skull, but police only found 1 bullet. Couldn't find the other bullet in his head at all. Assumed the police missed it. Went on as normal with the autopsy until we got to the chest cavity. The other bullet was just chilling beside his lung. Turns out it entered the skull, hit the inside, ricocheted down his neck, and into the chest. That was pretty wild. I took forensic lectures, so I saw quite a bit of crazy shit, but the things that stick are autopsy revealing a history of abuse, pain, and violence. A little more funny, a skeleton was found in the near mountains. It was very clear he died in an accident 20 plus years ago, however he had to be identified via DNA. Turned out his dad was not his dad, but his uncle. Sparked a whole public family drama show, cause the family was well known in my area. I heard a story once about a guy who died, and completely unrelated to the main complaint during the autopsy they found a grapefruit in his ass. Apparently it had just been there the whole time. My friend had to do an autopsy on a baby. The dad claimed she died after rolling off a couch. My friend found that the kid was slammed against a hard surface multiple times. Dad eventually admitted he hit the baby against the wall after she wouldn't stop crying. My friend had to quit that job cause it was so taxing mentally. I'm a pre-med student, and one time, while shadowing a forensic pathologist, 3 days before Christmas, he was doing an autopsy on an automobile vs pedestrian accident. The man's face was completely smashed in. When they take samples of the brain they cut the skin, pull it over the face, and the cut off the top of the skull. When they did, the skull was basically shattered, and bone fragments pulled back with the skin. And when they cut off the skull cap, the brain was obviously damaged, and the eyeballs had been pushed back / fallen through the orbits, and into the cranial cavity. The guy also had $10,000 in cash in his jean pockets. According to police he had a record involving drugs, so the theory was either a drug deal gone bad, or he stumbled into the road while under the influence. In college I took a figure drawing class and the teacher was adamant that you couldn't draw the figure if you didn't know what was in it, so he dragged us over to the anatomy lab and had the anatomy teacher show us 2 cadavers that were being dissected by their med students. When it came time to ask questions, of course, have you ever found something weird in a body came up. The story is as follows. They get a body, and for legal reasons they aren't told much about the person aside from medical history. They were told that the old man was a sort of rock star type and was a one-hit wonder from his youth and to use extra discretion with him in particular / not tell the students who might recognize him. The lab is full of 20-year-olds, and so nobody recognized who he was, unsure if the teacher even knew, but it didn't sound like she did, or what his deal was, so they wrote it off as non-useful information aside from his lifestyle. He had drug use and alcohol issues in his life and they were told he partied a lot. Cool. The body has a raging boner. Like 100% of the time. Teacher doesn't think much of it aside from that he was particular endowed and everybody wrote it off as not important to their studies. So they go through the general dissection that they do. One kid wants extra credit and the teacher said sure, dissect his penis/see why it's hard still, and write a report. Apparently they don't normally do that for that particular class, so the penis itself goes into shade from their dissections, so it would have otherwise always been a mystery. Kid finds an actual rod that he had medically inserted under the table, not in medical records, so that he would always have a boner and could get it up while on drugs. They suspect it was done over 30 to 40 years prior to his death. They removed it and keep it in the lab I believe to show their students as part of a section on under the table medical surgeries. Anyways, that was probably the best day in figure drawing class I've ever had. I'm a former police officer and attended several autopsies to record info for investigation files. One guy had been shot and killed, so the cause of death was pretty clean, but the pathologists doing the autopsy found a tumor the size of a walnut on his brainstem. He said the guy would have been dead in a few months, even if he hadn't been shot. Another guy was dead due to a steak knife being stabbed through his heart by his wife. She claimed she grabbed the knife because she was scared he was going to kill her, and when he lunged at her the knife just went in. But when the doctor pointed out a half dozen or so marks that looked like freckles around the wound, he swabbed to develop a solution that clearly showed they were tiny little poke marks. I was able then to get her to confess that he was goading her. Go ahead, do it, until she hauled off and kabobbed him. It's not always like TV shows where the autopsy is the aha moment that solves a case, but sometimes it really is. Disclaimer, I'm a doctor, but not an autopsy doctor, and had never really considered pathology as a specialty when I was in medical school. This event happened in anatomy lab when I was in medical school. In the preclinical years of medical school, most medical schools have students enroll in anatomy lab where we dissect cadavers as part of the course. One of the anatomy labs had a cadaver who had passed away from complications from kidney failure, according to the identification tab. While that anatomy team was dissecting some of the leg and buttock muscles, they found a bullet in the gluteus medius. No idea how it got there and totally unrelated to the cause of death. I like to imagine the guy signing paperwork to donate his body to science, thinking that the med student's dissecting his but would get a funny surprise. My dad did autopsies as a night job while he went to college during the day. He said the hardest ones were the children. He did an autopsy on a 6-month-old whose mother suffered from postpartum, and she told the cops that voices were telling her to put her son in the bathtub. She ran near boiling water and held him under. He said when he got to the hospital chunks of skin were falling off and the organs were liquid on the table. The other one he talks about are the people who are subjects of murder and they are buried. The decomposition process needs oxygen to break down cells, and when they are buried it takes a lot long for them to decompose. When cops find bodies they unearth them, and it takes a matter of hours for the bodies to decompose drastically. The smell of one particular individual that was murdered and buried in a cornfield for 6 weeks could be smelled from 3 floors above the operating room, and was so bad that it was making patients and nurses sick. Newly graduated doctor here. Maybe not a medical revelation per se, but a revelation to me when I was a student watching my first autopsies. Female, late 50s, very obese. Typical case, you might say. She died at home alone. Incision through very thick layers of fat. Then, every inch of her viscera was covered in fat. Slick, slippery, yellow. The sound is obscene. Her sternum and ribs are snapped open to review the chest. The medical examiner tells us the correct way to remove the organs is such that everything can be dangled from the tongue. My colleague leaves the room. Her heart weighed triple than that of the normal 70-something man lying next to her. What is supposed to be red muscle is just sickly yellow fat. When you touched it, the coronary arteries were rock hard. The lungs are next. Heavy, again. sliced into pieces by knife, and liquid starts oozing out of it. Squeeze it, air bubbles and more liquid oozes out from tiny alveoli spaces. Classic heart failure, pulmonary edema. Explains the swollen ankles. Some pus comes out too. Maybe she had a pneumonia. Liver isn't much better, although at this point you'd be more surprised if she didn't have fatty liver disease. Kidneys scarred from years of hypertension. Getting the brain out is the hardest to watch. A cut is made in the occipital scalp and the top of the head flipped onto the face. Saw opens the skull. Brain gets weighed like the rest. What it holds in her final moments we'll never know. It gets set aside with the other organs. When done, all the viscera is put into a plastic bag. This is put back into her open abdomen, now empty. They sew it all back up with thick sutures you wouldn't use in real people. The scalp is put back together. The skin is cleaned. The doctor leaves us with this gem as she hung up her gown. If only you could diagnose people like this in hospital and in surgery, your job would be much easier.